All right, David, Dr. David Belk, thanks so much for joining me today. My name is Jerry Topitzer. I'm the writer, producer, creator of Upcode, a comedy series about a brilliant doctor who is fighting against a ruthless insurance company and has to decide whether he's going to commit medical fraud in order to save his practice. And again, the idea there is it's a comedy, hopefully. And I've invited Dr. Belk on to talk about the medical profession and some of the challenges that have faced medical practitioners and especially primary care providers and primary care physicians. And really what underpins our comedy series is that conflict between doctor and insurance provider. And Dr. Bell, do you prefer David or Dr. Bell?
David's fine.
So David has written and spoken extensively on some of the challenges that practitioners face and also what patients face, more importantly, as it relates to the reimbursement landscape. And a lot of his discussion really was part of my research as I did hours and hours in research about this industry and this whole landscape. And so David was kind enough to join me in order to kind of talk a little bit about his research, his experience. He is a physician. He has a private practice, so he's lived a lot of what Dr. Fritz, our main character in our series, has been going through. And so I wanted to have him on. And so David, maybe if you could just kind of introduce yourself and talk a little bit about your background and anything else you want to share about kind of your background.
Yeah, my name is David Belk. I got my medical degree from University of Southern California, even though I grew up in Minnesota. Moved out here to California for medical school, moved up to the Bay Area, eventually started my own practice. So I guess I'm a solo practitioner in primary care, which is a bit of a dinosaur in this business. But because uh, because I'm a solo practitioner and because I kept the entire business very close to home in that my wife does my billing for me, I learned to understand better than most doctors how the system works and how incredibly dysfunctional it is and how incredibly deceptive and dishonest a lot of the billing and payment schemes are in medicine. And it was about 10 years ago, I decided to write all this down for a website that I call The True Cost of Healthcare, itemizing many of the clear deceptions, even outright scams. And it even led to a book that I wrote called The Great American Healthcare Scam: How Kickbacks, Collusion, and Propaganda Have Exploded Healthcare Costs in the United States. And it outlines quite a number of things that you're attempting to make light of in your new series, which I'm thankful for because people need to bring more attention to what's really going on. Obviously, the reality is much darker than how you'll portray it, but
Hmm.
it's a pretty bad situation for a pretty broken system, and most people just have no awareness. Most doctors even have no awareness of how truly bad it is.
Yeah. Yeah, and by the way, if anybody gets a chance and wants to learn more, please check out Dr. Buck's website, truecostofhealthcare.org. Is that right?
.org, yes.
.org. It's fantastic. It has a wealth of information, and it uncovers and reveals a whole bunch of the issues that David's referring to in terms of, like you said, the deceptions, right? The idea that any medical bill, right, that a patient is presented is
Is a
almost
complete work of fiction.
right, right.
Yeah.
Talk a little bit about that.
Right. Well, this is part of how they get you. You'll see this hospital bill for, three, four, $500,000 for, 2, 3 days in the hospital. And you're like, oh my God, I'm so happy my insurance covered that. And nobody reads the fine print where, well, the insurance company really only paid $30,000 and the entire rest of it vanished. It was a complete work of fiction that was never meant to be paid. Well, what that does is it sets people up because it frightens them about the system much more than they need to be. because $300,000 is a lot more frightening than $30,000, but it also sets people up to be taken advantage of, because if the insurance company decides to renege on you, even though they would have only paid 30,000, guess how much you'll end up paying when they say, "Oh, sorry, we don't think that that was justified. We're not going to pay," or something like that. Or if you don't have insurance, you would get hit by with a much, much larger bill. So I often say that the primary service health insurance companies give you, the patient, isn't so much paying for your necessary medical services, but more they're a protection racket. They protect you from fictitious overbilling. And that's not a very good system of providing health care for a lot of reasons that are pretty obvious.
And David, is it true to say that the reason why those bills that we all see, right? But just like you said, you see a bill, you go to the hospital for 3 or 4 days. There's a bill for $400,000, and the insurance company, let's say, covers 30,000. The reason why those bills keep going up and up and up is that. Can you talk a little bit about why those bills keep going up and up?
Well, it has to do with the confusion on how insurance companies pay. It's no exaggeration to tell you that vast majority of doctors have no idea how much they'll get paid to see a patient, right? Now, when I say that, I mean, your whole show, at least the first part, was about upcoding, about bill, billing for a higher amount than what you really saw for the patient. Well, the interesting thing is, you deal with maybe half a dozen or a dozen different insurance companies.
Hmm.
Well, each insurance company has half a dozen or a dozen different types of plans that will pay you a different amount.
Right.
So that billing code that you send, the higher code may pay more on average than the lower code, sure, but you have no idea what any of those codes will actually pay. The insurance company just sort of pulls numbers out of a hat. Well, with a hospital, it's 100 times more complicated than that. And I should go even further to say they don't even necessarily pay for the code. They could pay by an entirely different system. They sort of pick the system. And then you did go a bit into the networks, how you can be eliminated from a network. Well, it goes even further than that. You might be in 3 or 4 different networks with one insurance company and not in 5 or 6 of the other networks for the exact same insurance company. There was a time not too long ago when a patient could call a doctor and say, "Do you accept Blue Shield?" And the doctor would say, "Yeah, sure." Now it's like, "Oh, what Blue Shield do you mean?" There's like 5 or 10 different types. Some you do, some you don't. Some might have kicked you out without even telling you or the patient. So a patient who is your patient for 10 years, suddenly, without either you or they knowing about it, you don't take their insurance anymore? Really? That goes on all of the
And
time. Well, with hospitals, it's 100 times worse. A hospital, on average, has absolutely no idea what a private insurance company is going to pay them for any medical service they provide. And so they just keep piling on greater and greater billing charges. I call it the kitchen sink method of billing, where they throw everything into the bill that might get paid by any particular payer. They're in this giant amalgam of redundant billing charges and insane overpricing of all the different services that might get paid. Then they send the bill off to the insurance company and take what they get. You know,
so the medical provider, whether it's a private practitioner or a hospital, basically is incentivized, like you said, to use this kitchen sink method of putting everything in because there's so much complexity on the reimbursement
hmm
from the insurers, and like you said, then even the multiple networks within each insurance provider that they're incentivized to just put everything in hopes that they're going to get paid roughly in line with their expectation.
And many doctors in private practice long ago gave up and they hire third party billing companies that are incredibly predatory, to say the least. And
Mm,
so the doctor may not even know that the billing company who's operating in his name is really, really screwing over his patients, and
hmm.
wonders why the patients are in such a bad mood all of the time,
Right, right, right.
which is not unusual in this business.
And I know that in our chats separately, you got to a point where you really became quite personally disillusioned with all this because you were finding that in having to kind of support this scheme, right, I'll call it, of just having to overbill in order to get paid just what you're justified in earning. That you said you got really quite personally disillusioned. Is that fair?
Well, I guess you could say the more I find out about how this system works, the less I trust anything that I hear about it. And yeah, it's hard not to be disillusioned when you find that you're the front man for an enormous scam. I
Mhm.
mean, and I should clarify that healthcare as a whole in the country isn't all a scam.
Sure.
Many of the services we provide, we do treat diseases, we do cure diseases, we do prevent diseases that ought to be treated, cured, prevented, and the pills that we provide, the therapies, they work for
Right.
the most part. I
Right.
mean, there are times when healthcare gets hoodwinked and supports some less than, but for the most part, what we do actually works.
Right.
But how we provide it in this country is an enormous scam. It's horribly, horribly misguided. And it's alienating the public. And now it's starting to alienate most doctors as well.
Well, and that's a really important point because that's, I think, part of why I wanted to create a show from the perspective of a doctor because
Mhm.
look, I have enormous respect for doctors. My father was a psychologist, so I have just a real affinity for people who go into a profession that is inherently giving care to patients. I think it's incredibly important, and it's the highest one of the highest callings one can pursue. And I think what I wanted to do, and I think what you're highlighting, is not that doctors uh, are out to scam patients. That's not the point. The point, I think,
Well,
you
some
and
are.
the series. Well, sure, but I
Some are.
no
Don't
no
don't don't get me wrong. Some
right,
are.
but I
Some are. I mean, doctors are human beings, and there are as many scoundrels among doctors as there are among any population. It's not.
sure,
It's not like you suddenly become a saint for having gone to 4 years of medical school and done a residency.
right,
Quite a number of people do go into this business largely for the money and the status, and that doesn't make them in and of itself great people.
true. No,
Doesn't
that's
make them
all
bad
that's fair.
necessarily. Not everyone who wants heist, but yeah, it's not. So to yeah, I think should dispel the illusion that simply because we're highly trained professionals, we're all wonderful. If that
No,
was
no,
ever an illusion, yeah.
no, but I think that's what we're really talking. I think about is
Hmm.
this is a system with a whole bunch of incentives, right? And I'm fascinated by incentives myself, and
Right.
I think it's really the driver for this show. It's like the incentives really are set up for doctors to continuously push up their costs and continuously
Correct.
push the envelope on bills and charging patients. They are incentivized to do that
Hmm.
economically in order to keep their practices alive. And I think
Yeah.
that is the thing that people have no idea about. And that's what I really wanted to shine a light on with the series. And so yeah,
Yeah, there's no penalty for overbilling in this business. There is no law that says a doctor can't charge $10,000 for a 15-minute appointment, and some actually do.
hmm
And they
right,
don't get paid that usually, but those billing charges are what just add up to insane amounts of money, and if nothing else, truly frighten and deceive people.
right. And as you're saying, the it's one thing where this is as I research this more, and you do a great job of talking about this in both in your book and your speeches. Um, Insurance companies are incentivized themselves for healthcare costs in this country to be as high as possible. And so I wanted you
Exactly.
to maybe chat a little bit about. Can you talk a little bit about why that is?
Think of an insurance company as the ultimate middleman. All money that goes into healthcare goes through them in some way. They process every single dollar that goes into healthcare and they keep a percentage of every dollar that goes into healthcare. It's kind of a fixed percentage. You can talk about the medical loss ratio, things like that, but just think about they keep a chunk of every dollar that goes into healthcare one way or another. They're in charge of the flow of money into healthcare. Well, you don't have to think too long to realize the more money that goes into healthcare, the more money they keep. In other words, $200 billion goes into healthcare if they keep 5% or 10% of everything, right?
Right.
$200 billion goes into healthcare. Well, 10% of that is $20 billion. $400 billion goes into healthcare. Well, 10% of that is $40 billion. That's just math.
Yeah.
And so they have an enormous financial incentive to see prices go up. And this is what people just don't understand because we have been taught to believe, indoctrinating to believe, that insurance companies are the ultimate misers, that they are the Ebenezer Scrooges of healthcare, when in reality, they're more like Scrooge after the three ghosts and maybe 6 cups of eggnog. They, they are very incentivized to see prices go up. But that's the last thing they'd want you to know about them, which is why they pretend to be such incredible misers and they do everything they can to throw roadblocks in front of doctors and every other practitioner who is just trying to do the best for their patient. It's like, no, 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 we don't want you to do that. We don't want you to do that. They always do that, not because it would even necessarily cost them any money, but to create the illusion that they are misers when in reality they're more like drunken sailors on shore leave when it comes to how they want the money to be spent. Because
Mhm.
keep in mind, every time they get in the way of a medical procedure, chances are they're not saving any money at all. If anything, um, well, imagine if, an insurance company denied you the right to fix your roof while it was leaking and would only wait until it caves in. How
Right.
much money would you save on home repairs? Right? So anytime an insurance company actually does try to interfere, unless there's a direct conflict of interest going on, which is not that common, they're really just delaying medical care, which if either has no effect at all on the price or might actually raise the price because medical problems that need to be addressed don't get cheaper if you postpone the therapy.
Mhm.
And so they play this game constantly, and they're enormously frustrating when they are playing this game, and they know they're not really helping anything. But it's not their job to help anything. It's their job to ensure that costs keep going up. And they're really sort of playing against everyone in that. But again, they are in control of the stream of money that goes into medicine.
Right.
Every dollar. I mean, you go through your insurance company for every pill you buy, every x-ray you get, every time you see the doctor, everything more than maybe a band-aid, you go through your insurance company, which means they're in charge of the flow of money. Obviously, they want that flow to be as big as possible. And
And
so it is in the United States.
right. Right. Yeah. And and David, so your practice is talk about where your practice is and the nature of your practice a little bit, if you don't mind.
Well, once again, I'm a primary care physician, general internal medicine. I have a solo practice in the San Francisco Bay Area.
Hmm.
It's a very, very small operation, much smaller than the doctor in your show.
Yeah.
We're quite a bit more low tech and more humble.
Hmm.
But yeah, it's generally a pretty slow practice.
Hmm.
So yeah, I've been in practice for myself. Oh, I suppose, yeah, it'll be 18 years in a few weeks,
Wow.
So it's gone through good times, gone through not so good times, but yeah.
Yeah. And and did you have expectations around, kind of what life was going to be like as a doctor as you were, kind of coming out of training, coming out of residency and fellowship? When what were your sense about what your life was going to be like, and yeah, what has it been? If there's a contrast.
I actually had no idea because I did my residency at a very busy county hospital, Los Angeles County Hospital, and so I was mostly in the hospital, mostly taking care of, the poor, the disadvantaged, and, there was a lot of independence, but there was a lot of chaos, and then I went into this nice, cozy private practice near a very small private community hospital with a very, very different set of patients and very, very different set of expectations where I was doing mostly outpatient, which it couldn't have been more different. And
Mm,
it was almost kind of a culture shock for me when I started doing this. And for the most part, the first several years went pretty well. It had its ups and downs, but it was, lately. I think we already discussed this. I've said that business has been dropping off, dropping off, dropping off, sort of like the doctor in your show, to the point where I'm pretty much considering that by the end of the year, I'm probably going to close up shop and go into something else.
mm, mm,
You know, do pursue another career,
mm,
um, because, well, first of all, it's no longer really paying the bills at all anymore. Fortunately, I have a wife who works, so I can rely off of her while I'm finding something else to do with my life. She's a nurse,
mhm,
and
mm,
paradoxically, she currently makes a lot more than I do, simply being a nurse employed by a major hospital here in the Bay Area,
right,
which sort of shows you how backwards this business is.
right.
But yeah, she's a nurse, and so while I find a new pathway to go, yeah, we'll sort of be relying off of her.
Yeah, which I think would come to. I think that would come as a great shock to a lot of people who, even including myself, before I did a lot of research. That I think most folks think of doctors as entering a career that is financially among the most sure things you can imagine, and the challenges that I think, especially as you say, solo practitioners, small practices face when it comes to what you have to pay for, infrastructure,
Mhm,
billing, in order to face off against these insurance company reimbursing these reimbursing parties,
mhm.
just to get paid, and then you've got to pay rent and then staff, etc. All of those kind of costs versus the system that's kind of set up against you. I think people would have no idea that such challenges would occur, and would create such financial, roadblocks.
Yeah, it's again, it's a system in which an enormous amount of money goes into healthcare, so everybody assumes that everyone must be benefiting from it. But of course, you get an enormous amount of parasites who have gone into healthcare and learned to tap it in their direction.
Right.
Obviously, it's not distributed quite as evenly as it ought to be. I mean, certainly there was a time not too long ago when it wasn't hard to make a living as a doctor at all.
Hmm.
I know because I was there.
Right.
And things have become progressively more difficult for those of us who I say are more on the margins. There are fewer people who really need primary care as often as they used to, fewer people who'd like to go into it, far more people, because the system is so predatory and so disorienting, who simply are terrified to go to the doctor, and they wait until they need to go to the emergency room or whatever, and it's a system that is increasingly marginalizing more of the people within it. And I think a lot of people will tell you, primary care, most of us in primary care, we kind of feel like dinosaurs waiting for our meteor.
Mm-hmm.
you know
Which is so sad, because that's really the front line. I mean, that's again why I wanted to have the main character in the show, Dr. Fritz, be a primary care provider, because in a way
hmm
that is, your first the first doctor you see, right? There's a reason why it's called
hmm
primary care, right? Is a primary care
We're the
physician,
gateway to the whole institution, yes.
right?
And we're usually asked by all of the other specialists to do all of the stuff that they'd rather not to do, is to get the patient ready to see them, and this and so on. So to a certain extent, I still think the system relies on us, but not to the point where they think that they need to, send much our way.
Right. What advice would you give, a brand new, kind of fresh out of, um, training, young doctor who wanted to go into primary care because that was, their particular passion. What advice would you give them?
I don't think I'd recommend it. I mean, you're asking somebody who's trying to get out of the business after 20 years. Hey,
Right.
what advice would you go somewhere else?
Yeah.
It's you can't predict the future. All
Mm,
right, you really can't, and so it's difficult to know. Certainly, I wouldn't have known 10 years ago where things would be now, and I don't know where they'll be 10 years from now.
mhm,
If you're trying to make a practical decision, certainly this isn't where you'd be likely to want to be now. I mean, there are certain large medical practices where you're probably still going to do okay.
mhm,
So if you want to join a large medical practice, obviously they're going to work you to death, but they'll probably compensate you okay, and they'll probably even give you some benefits. If you want to open a solo practice right now, good luck to you. Now, again, the best advice you can ever give, best career advice you can ever give someone is try to find something that you really love doing and try to get paid for it. And if this is something you really love doing, well, just realize it might take a while to get off the ground if you ever do, if you're trying to do it on your own, and you may have to become a part of a large corporation, which is, disillusioning,
mhm.
right? You really are a small cog in a giant machine.
Yeah.
Though you're treated like you are the face of healthcare, you're a small cog in a giant machine.
Mhm.
And so it's rather difficult. I don't really have any good advice for people who are coming out of residency right now in terms of how they should organize this system, because I think as the system is going, I don't believe it's sustainable as it is for a very long time.
Yeah.
And so I have no idea how things are going to play out over the next 5, 10 years. I just don't think that what's going on right now is in any way sustainable, which is another reason why I'm perfectly happy to get out, because the uncertainty is not a pleasing thought for me.
Yeah. Yeah. Yeah.
Uh,
Um, what do you think is the right way to run this whole, process of reimbursing providers for medical care? If you could draw up the system and
well, obviously, transparency and accountability.
yeah,
I mean, you can't have a system where nobody knows how much anything ought to cost or how much you might get paid for anything you do. But that's where all the deception. If you're trying to take advantage of people, which is what the insurance companies are about, well, then you have to maximize confusion.
right,
And so a far more direct, more honest, more transparent, more accountable system is what you need, which is exactly what you don't have. And, good luck trying to tell the insurance companies that. That's a little bit like telling a mafia crime family they should be more transparent about what they're doing. It's not, clearly the people who run the show, the people who control most of the flow of the money, have a vested interest in making everything as opaque, as dark, as incomprehensible as possible. And, trying to fix that with their consent, good luck.
right, right, right. No, that makes a lot of sense.
Hmm.
Um, this is everything you've been talking about and all of the issues that you've highlighted on your website and your book are so important, and I think they're so eye opening for folks, and
Hmm.
especially as patients. What advice would you give to patients who, all of us at one point or another have to enter the system, right, and are going to be presented with these bills? Are we just, are we kind of merciless in all of this, or what would you? I'm sorry, helpless in all of this.
You're not
What
helpless. First rule, make sure that you have an understanding of the price of everything that you're getting if you can. For example, I tell this to people all the time, and it doesn't make any sense to them, but here you go. If you're prescribed a medication, it's quite possible, likely even, that you will pay less for that medication if you pay cash and don't use your insurance than if you do use your insurance and pay a copay.
Hmm.
All right. Um, if
So I just
you
want to make
are
sure I think I understand what you said, but I want to highlight what you just said because it's amazing to for people to understand. So even folks that have insurance, right,
right,
and they have to get medication. You're
right.
saying in a lot of cases it's better to offer to pay your doctor cash
No,
or
no,
your
not
or
the doctor, the
pharmacist.
pharmacist.
Sorry, pay the pharmacist in cash. It may well be cheaper to pay in cash for that than it is to pay your copay under your insurance
Right.
policy, which is
9 out of
incredible.
10, 9 out of 10 prescriptions filled in this country are for generic medications. Vast majority of generic medications, contrary to popular belief, cost pharmacies pennies a dose. And many, not all pharmacies, but many pharmacies are quite willing to sell generic medications that you get for your blood pressure, your diabetes, your cholesterol, most of the stuff we treat, the antibiotics, for a lower price than the copay your insurance company has determined you should pay. And this can be a savings of as much as hundreds of dollars a year, if
Wow.
not more.
Right.
Okay. Same with medical procedures. It's not, if you're on a very high deductible and a doctor orders an x ray or a CAT scan for you, you may save a lot of money by not using your insurance and saying, I'd like to pay cash for this CAT scan or this ultrasound rather than use my insurance and let my insurance negotiate the rate. Because when you're on a high deductible, the insurance company is negotiating with your money.
Hmm.
Guess what? They don't care how much you pay. In fact, they'd rather you paid more. All
Well,
right.
that's yeah.
But if you do need a procedure or something for which you do need your insurance because it's a bit expensive,
Right.
absolutely make sure that whatever provider you go to is in your network on the day of that service. And here's a little trick, I say the networks love to play the network shell game,
Hmm.
where they rotate networks and providers go in and out of network without them even knowing about it. Okay. And they don't update their networks either,
Right.
meaning you could go to a hospital and get some procedure done or something like that, and it was in network last week, and then suddenly you get this $30,000 bill for for a 1 hour procedure, and they say pay up, you're out of network. you know well, always check the day that you get the procedure that you are in network
Hmm.
and take a screenshot of it with that date.
Wow.
Because if the insurance company's website said this hospital was in this network on that day, you can bring it to them and say, you said it was in network on that very day. I got the proof here. You got to pay up, and they can't deny you. That's
So
that's the one real tip that you can that can really save you a huge amount of money.
so right, and so that is it's an incredible bit of advice, and it's for me it's hard it's kind of heart-wrenching to hear that if I have to go in for life-saving surgery and all the emotional stress you're going
Yeah,
through, right?
I don't think I'll have time to check networks then. And that is
Well,
and right now they're trying to pass laws that they can't deny you for being out of network in an emergency. Like, hey, I was supposed to check my network when I was having a heart attack.
right,
No, they're starting to back down on that. Though they were doing things like that at some point.
right.
It's pretty bad. It's
Yeah.
a very slimy system.
Well, I mean, anecdotally, my mother-in-law, who had you know vascular disease, had to go
Mhm.
in for a procedure, and it was arguably she was in the ICU. I mean, it was the procedure she had to go through was absolutely it was medically crucial. Forget about medically
Mhm.
necessary, but because even though the hospital was in her network, right? Even though her primary surgeon was in network, the night she had to do it, a different surgeon had to operate, and he
Exactly.
himself was not
Was out of
in
network.
network, and so the bill she got, even though she was insured, was astounding. And over a
Happens
year
all the time.
later, they're still going after her for this bill, and it's like, how
Mhm.
often does that? I'm sure it happens over and over
Happens all
and
the
over.
time.
Yeah.
It happens all the time. And, sometimes, just for an assistant surgery it comes in. And yeah, like you really have a lot of control over, which doctors see you when you're, in a coma in the ICU or something like that. I mean, it's
Right.
ridiculous. It
Right.
is.
Yeah.
And this is a game that they play. And doctors will play it too. I mean, they'll go out of network because they know they can bill more.
Mm,
Like I say, we're not all saints in this business,
right.
especially in hospitals. In fact, I can share a similar story with you. When my son was born, right?
Mm,
We went to the hospital. It's the hospital in the Bay Area that, or at least our part of the Bay Area that delivers the most babies. It's the one that, all the obstetricians go to. We went to the hospital months in advance to register, talk about all of these things. And you know and they even say, well, yes, we have an anesthesiologist on staff in case you need an epidural, and all this is arranged in advance, right? Now, I'm a doctor, my wife's a nurse. It's not like we don't know the system. She even does my billing for me,
mhm,
right? And after our son was born, we get balance billed by the anesthesiologist. I mean, the insurance company actually even paid the anesthesiologist what they would normally pay.
mhm.
But because the anesthesiologist billed more than twice as much as the insurance company was willing to pay them, they came back to us and said, "You owe us the rest of the money because guess what? We haven't signed on with any insurance company, so we're not obligated to take what they pay."
Hmm.
Right? Nobody told us this in advance.
Wow.
And well, the benefit was my wife's pretty good at negotiating, at going through these systems. I mean, she's the one you go to if you really have a problem with this. She calls up the insurance company and screamed at them because they guaranteed us in advance in writing that everything was covered. And so, the fact that they didn't tell us that, these anesthesiologists don't sign on with any insurance company because it allows them to balance bill.
Wow.
You know, you could have told us because it's the same anesthesiology group in that hospital all of the time. It's not like this should have been a surprise to anyone.
And like you're saying before, none of these parties, whether it's the insurance company or the hospital or the anesthesiologist, they're all incentivized to actually keep this
Screw
a
you.
big, deep, dark secret and to tell you nothing up front, right? The last thing they want
Exactly.
to tell you is, oh, here's a price for a service or a procedure up front. So you have certainty
Right.
so they can play
There
this
is a
game.
reason. There is a reason that consumer advocates insist that when you take your car for repairs, everything that might have to be done has to be discussed with you in advance. However, these consumer laws that affect your auto mechanic don't affect anyone in healthcare. They are allowed to operate completely in the dark. And guess what? There's a reason why most muggers work at night. The same reason, the dark helps you, and
That's
if
right.
if that's what you're after. And so, yes, everything is hidden, everything is deceptive, you know, and most of what you're being told about any of this is complete fiction,
Yeah. Yeah.
deliberately so. Misinformation.
Right. Well, it's the whole system is absurd, which is part of why I wanted to try and make a comedy out of it, even though everything that we talked about is not funny. It's
Yeah.
really quite serious, and it's quite awful. It's terrible on patients. It takes a toll on medical providers. But I feel like, in a
Well,
way,
if you can get people to laugh at it, you probably get them to pay attention. One of my biggest challenges is people look at my stuff and they just throw up their arms and want to cry and say, "What can you do?"
right.
And I suppose if I found a way to make it more funny, I might get a better audience and people to pay more attention.
I'll let you know. I'll
Yeah,
keep
we'll
you posted.
see. We'll see. It's a noble effort, because it is difficult to get people to look directly at this and see exactly what's going on, because then all they say is, okay, what do I do about this? And if enough people become aware of it, they will do something. I firmly believe that.
right.
but it's almost a catch-22 because each individual, when they look at it, just wants to walk away.
Yeah,
Like, okay, there's enough problems in this world. I don't need more, you
yeah.
know?
But it is such an important issue. It affects everybody. Everybody will have to have some form of medical care in their lives, almost everybody. And
And even if you don't, the premiums will kill you.
that's they absolutely will.
Yeah.
And if not themselves, we all know somebody who's going through some form of challenge, with a fight with an insurance company, a fight with a hospital system. We all know somebody who's going through this, and it's really heartbreaking. And yeah, so I think, I want to thank you for shining a light on this, and
Mhm.
also, hope in hopes that we can also shine another light on this comedically, but highlighting the absurdity of the system so that people can say, hey, this is funny, but it's, maybe we should take a look at this a little harder. So
Yeah.
yeah, so thank
Mhm.
you, David, for your time and all
Mhm.
your efforts, and yeah, thanks for spending the time with me here and talking about all these issues. And yeah, I hope our show can continue to shine a light on all these challenges.
Keep trying, you know? And thanks for having me. It's been great talking to you.
You too. You too.
Mhm. All right.
All right. Take care.
Mhm.